Hi everybody, Dr. Baumholtz. Just had an awesome day teaching the residents and fellows over at the VA hospital, and it got me thinking as I drove back to the office that there are questions I get asked pretty frequently, both out and about and here in the office, and I thought maybe we could do a little series where we tackle some of the most common topics, and not necessarily a great drawer, but I do like to draw, and you'll see that in just a second. And so I thought we would start with a really popular yet confusing topic for patients that come both here at Baumholtz Plastic Surgery and other places, and that is a woman will come and the question is, I just want an implant, but I might need a lift, and how do I decide? So that's my introduction. This will go on for a little bit. This will probably be on YouTube, and we may use it elsewhere, but let's go this way. And again, I apologize in advance for my handwriting, and I hope that we can see this. I'll try to move this in a little bit, then you'll just hear the sound of my voice. And what I'm doing here is we're talking about the difference between implants and lifts, and has everything to do with the relationship of the nipple to the fold. And the fold is where the breast touches the body wall. Generally speaking, if the nipple is at or above the fold, we can talk about implants pretty much all day. If the nipple is below the fold, like a little bit below the fold, then we can probably get away with an implant, right? But we got to have the understanding as to what that means. But if it's really below the fold, I think at that point we're going to talk about the need for a lift. The problem with doing an implant, when someone truly needs a lift, is you've really just given them a bigger, saggier breast, which is not a look that most people want. Historically, these were done in two separate operations, but in the modern version of this, we tend to do them as a single stage operation. And I'm just going to talk a little bit about what that surgery looks like for me and for my patients. And so what you basically do is we decide where we want the new nipple to be. We make a new opening where the areola is going to go. And then it's a geometry problem in terms of how we manage the skin, and then what kind of look we want to give. And so when the operation's over, we end up with a more youthfully placed nipple areola, a scar around that, and then underneath the breast. Now, I'm going to pivot back to me for just a second, because this is another important concept. A lot of times the question comes up, what we do with this. This is not breast tissue, this is tacos and donuts. And so for a lot of patients, myself included, that have this extra tissue, if I want to give a woman a more defined, what we call lateral breast sweep, or outside of the breast mound, I will take this incision, and traditionally that incision would go off toward the back, and that interfered with the gal's ability to wear a low back outfit. So I'll take this and I will sweep it up towards the armpit, which tends to hide the scar along the body sidewall and lets us gather up a great deal of tissue. That's really sort of the fundamentals, at least as I approach the notion of whether someone needs an implant alone or a lift. If we're talking about position, we're talking about lift, we're talking about volume, we're talking about implant. If you'd like to know more, please contact me at the office, and I would be glad to answer your questions. Have a great day. This is Dr. Baumholtz, and please let me know if you enjoy this format of instruction, and I'll be happy to keep making them. Thanks.